Hi, and welcome to our telehealth video information series. My name is Garvin, and this video is on Emla Cream. So we start with what is Emla Cream used for? Emla is a local anesthetic cream that's used to numb the skin before potentially painful procedures, such as for adults, injections, inserting IV catheters or taking blood, and minor skin surgery, for example skin grafts, and cleansing of leg ulcers, and surgical removal of genital warts, and injections of local anesthetics into the genital area. And Emla is used in children for injections and inserting IV catheters or taking blood, and minor skin procedures or surgery. So how does Emla work? Emla Cream contains two active ingredients, lidocaine and prilocaine, which are both medicines called local anesthetics. They are used to numb the areas that would otherwise feel pain. Pain is caused by the stimulation of pain receptors at the end of the nerves. The stimulation causes sodium to enter the nerve ending, which causes an electrical signal to build up in the nerve. When this signal is big enough, it passes along the nerve to the brain, where the signal is interrupted as pain or interpreted as pain. Lidocaine and prilocaine temporarily block this pathway of pain signals along the nerves by stopping the sodium entering the nerve ending at the site of pain. This prevents an electric signal building up and passing along the nerve fibers to the brain. When Emla Cream is applied to the skin, the lidocaine and prilocaine prevent pain signals passing from that area to the brain. This means otherwise painful procedures can be performed without causing pain, although you may still feel pressure and touch. So how do you use Emla Cream? Emla Cream is applied to the area that needs numbing, and a dressing is usually then put on top. The cream is not rubbed into the skin, and the cream and dressing are removed just before the medical procedure starts. Wash your hands after applying the cream, unless your hands are the area being treated. Take care to avoid getting the cream in the eyes, as this could numb the eye and prevent its protective reflexes. If you accidentally get the cream in your eyes, rinse well with lukewarm water or saline solution and protect the eye until sensation returns. Do not apply the cream to cuts, grazes or wounds, except leg ulcers, or areas where there is a skin rash or eczema. And do not apply the cream in or near the eyes, inside the nose, ear, mouth or anus, or to the genitals of children. Who shouldn't use Emla Cream? People who are allergic to other amide anesthetics, for example the Bupa vaccine, Rapo vaccine, and people who are allergic to any ingredients of the cream. The cream shouldn't be used on babies who were born prematurely, so before 37 weeks gestation, and the cream shouldn't be used on babies under 12 months of age who are being treated with medicines that can cause a disorder of red blood cells called methahemoglobinemia, for example the sulfonamide antibiotics. So Emla should be used with caution in people who lack the enzyme glucose-6-phosphate dehydrogenase in their blood, and people with the red blood cell disorder, methylhemoglobinemia or anemia. Also, people taking medicines that can cause anemia or methylhemoglobinemia. People taking antiarrhythmic medicines to treat an irregular heartbeat, for example amide-type, and people with atopic eczema. So can you use Emla Cream while pregnant or breastfeeding? Emla should be used with caution during pregnancy and only on the advice of a doctor. Make sure your doctor knows if you are or think you could be pregnant before using it. Lidocaine and prilocaine pass into breast milk, but in amounts that are probably too small to be harmful to a nursing infant. However, you should make sure the doctor knows if you're breastfeeding before using it. If you're breastfeeding, you should not apply the cream to the skin on or near the breast to prevent the child accidentally ingesting it. What are the possible side effects of Emla Cream? So common side effects would be paleness, redness or swelling of the skin at the application site. And uncommon side effects: mild burning, tingling, itching, or sensation of warmth at the application site. And this is a common side effect when the cream is applied to the genitals or the leg ulcers. So can you use Emla Cream with other medicines? There may be an increased chance of a blood disorder called metahemoglobinemia if Emla is used by people who are being treated with other medicines that can cause this side effect. Emla should be used with caution in people taking medicines to treat an irregular heartbeat, for example amide-type. Because if sufficient quantities of Emla are absorbed into the body, it may increase the risk of side effects on the heart. So that brings this video to an end. If you have any questions, you can leave them in the comments below, or contact us at Lynch's Pharmacy in Broaddale in Douglas, or ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.